Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Next, we are going to call up Peggy Helton from the Texas Primary Prevention Planning Committee around Texas coming together to make change. Yeah, Texas!
So I'm Peggy Helton. I am from the Texas Primary Prevention Planning Committee, which we call the PPPC. It is the PPPC in Texas that has the responsibility of guiding RPE. So in the last about 2 years, we have changed everything about RPE. So we've made some significant changes, and I'm going to tell you a little bit about the process of that. But before I do that, I'm going to tell you why we did it. So when VAWA was reauthorized, Texas lost about $600,000, and we had a great plan at that time. We knew we couldn't sustain it. We knew we couldn't sustain our funding structure, so we really knew that we had to make some changes. And so we set out to do that. So the PPPC came together and we did what we called a plan amendment. And so as a result of that, we fund sexual assault programs. We went from 49 programs to 25. We went to competitive funding. We went to everybody who got funded got the same amount, and we had an amount that we thought could hold a position and a half for every organization. We had 11 lovely goals. We went down to 1. So we really prioritized our risk and protective factors. We prioritized where we saw RPE could do the most good. Then we went from 1 outcome to 11. See, it's funny now, but yeah. It wasn't so funny then. And we had standardized measurement tools that everybody began to use. And so how did we do that? We started with the right people at the table. And I can say Texas started in the beginning of RPE with the right people at the table with our PPPC. So we have the Health Department, we have the Attorney General's Office, we have our state coalition, the Texas Association Against Sexual Assault. We had RPE-funded organizations there, which we asked them to take off their organizational hat and make decisions based on what was good for the state. And we had community stakeholders. And so we came together to do a plan amendment. And I can tell you the process was hard. It was very real. We knew that we were affecting people's lives. It was very emotional, but we also knew it was very necessary. So we had 3 things in mind. We wanted our plan to be clear, we wanted it to be simple, and we wanted it to be realistic. And so I could stand here and tell you about the process, but what I'm going to do is I'm going to let our PPPC members tell you, and I know they're not here, so I brought their words with me. So we came to know what we had aha moments where a PPPC member would just say something profound. And so I'm going to share those with you. So the first one is, and I'm going to try to say it how they said it, okay? I don't know of any evidence-based way to educate someone whose mind is closed. We were talking about the climate that we knew implementation had to happen in. We knew we'd done our homework. We knew that everything we wanted to do was justified by research, justified by data. We were field informed, and we still knew that we had some limitations because of our climate, and that was frustrating. Is this one of those times when we are beating a dead horse? Or in other words, we're insanity, because it was hard to let go of things. So we knew we were narrowing things down, and that was really hard, and we didn't want to do that. So we would make decisions, and then we would go back and rethink our decisions, because we'd try to figure out a way to get it in there. It was really, it was a tough process. This is my favorite. We needed to know what we didn't know before we knew we didn't know it. because information comes when information is available. It doesn't necessarily come when you need it. And we had folks who were doing research. We were in the middle of our university doing a prevalence study. We had a lot of data that we were looking through. We had a lot of things coming at us. So this became our touchstone. If it was truly information that we needed to know before we didn't know, before we knew we didn't know it, then we would go back and it would inform our process, and we would go back and make adjustments based on that. If it was just good information to know, then we kept moving forward. Oh, I forgot how to do this. Okay. Okay, I'll laugh when I hear this. Where are we going? We don't know because we're not there yet. So we had process people on our team, and we had goal-oriented people on our team. And the process people started out, and they thought, wow, this is great. We don't know where we're going, but it's going to be awesome when we get there. And the goal-oriented people were like, well, we need to know where we're going so we can figure out how to get there. And so the process people really kept us talking about issues, and the goal-oriented people kept us moving. So if you have both at your table, you're really lucky, and they're going to drive each other crazy. They did us. Reasonable does not mean everything. So this came about because we were narrowing our goals down, remember, from 11 to 1. And what we ended up realizing that we did is a lot of times we just collapsed everything into a broader topic. And so we didn't keep anything. So one of our members said, you know, I don't know that we really let anything go. I think we just collapsed everything. So we ended up having to take a few steps backwards. We had to think about, are we really prioritizing here? Or are we just trying to keep everything and hiding it and making it look a little different? Okay, this is my favorite. We just talked about slowing down and being more reasonable, and somebody else just said, yeah, we're not going to rush into that one. And this is because we were driven people. I mean, we were trying to end sexual violence, and so we wanted to do everything. We wanted to do it right, and we wanted to do it right now. And we had a lot of deadlines coming at us. We were going through 2 state agencies' approval process. We were going through grant cycle deadlines. We had a lot of things telling us the timeline in which we needed to do things. And it was really hard to know when to let go, when we had actually done our best work, and this was the thing that we had to go with. So we still struggle with this one. This actually came up at our last meeting, actually. There are some things that we think we did well when we gave our recommendations to the OAG and to the health department, and we knew that they were going to say yes. You know, they were going to go with those recommendations. We hit the ground. Myself and a co-facilitator who's here, Tim Love, say hi. We went out to the field and we started talking about the changes, and we did it about 6 to 8 months before they were going to have to apply. So we had intensive TA training for them. We did training on the new plan, the new funding structure, and everything so that they could be ready, so we could equalize the playing field, because we knew we weren't going to be able to fund everybody, and we told them that as well. So we think we did that kind of well, and we got feedback from folks. And with that feedback, we went back to the PPPC and we actually made some adjustments based on what the field was telling us. There are things we'd wish we'd done differently, like remember that it was a process and it takes time, and everything took longer than what we thought it would. Just everything did. Was it a success? So we implemented in February, so we don't know yet. I'll have to get back to you on that one. We will know eventually, because we have good outcomes out there to tell us that. But there were some successes that we claim right now. And the first one is one of our funded agencies that did not get funding this round. They took their proposal to their community. They told them they lost their funding. Their community funded it, and they funded it at a higher amount than what our grant was, and so they continued that. So that was amazing to us. So we thought that was a success. Yay. Our PPPC is still working. Our relationships are strong. Our partnership is strong, so we think that's really a success. And then in the end, Texas came through the process and we are still preventing. So we think that is a success. And I just want to share with you something that one of our grantees said before they knew they were going to be a grantee, actually. They said there's a lot of changes, and it was hard, but it's better. They said that was the work that they really felt like we were intended to do. And another folks told us that finally they felt that the funding matched expectations, so that made it all worth it. So we have a lot of information. We invite you to our roundtable. We have a lot more things that we think we could have done differently to talk about, and so our co-facilitator Tim will be there, and we just invite you to come and have the conversation. We're really interested in hearing what you guys are doing as well. So thanks.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.